why these concepts was so helpful in my journey. That's why I'm trying to pass it to others. And let's do a brief review about how the aorta and pulmonary is made and the ventricles are made, and then we will read the text of first day next day. So we said that atriums are made like this: endocardial cushion in between, first premium, symptom premium, and then symptom secondum, and we understood everything about that. So imagine that the right and left atrium are made. Now it is the turn of right and left ventricle to be made. This is, you see that now ventricles are like a hole, right? This is like a hole. And this part of the ventricle has a muscle which is a little bit dividing two ventricles from each other, but inside there is a hole. You see that this is a hole, and there is a connection between two ventricles in the embryo. Now, this muscular part of the uh, interventricular symptom, or the muscular part of the ventricles, starts to make a symptom toward the endocardial cushion. Right? This is called interventricular symptom. And if this symptom is not met, it is called VSD, ventricular septal defect. So it is so easy about ventricles. About atrium, there were a lot of symptoms and a lot of things to know. But about ventricles, we know that ventricles has a muscular rail, which is a little bit disconnecting two ventricles, and from this muscular layer, a symptom goes towards the endocardial cushion and disconnects left ventricle from the right ventricles and separates two chambers. And this is right ventricle, RV, and this is LV, left ventricle. And this is left atrium, and this is right atrium. Now heart has four chambers, right? And the other thing is that how this pulmonary and aorta is made. We know that pulmonary is starting from right atrium, and aorta should start from left atrium. At the beginning, whenever heart doesn't have any symptom, you see, this is the heart, and imagine this is right atrium. We already studied that right atrium is made, left atrium is also made, and this is endocardial cushion. This is the muscular part of the ventricles, right? The muscles of the ventricles, which is trying to a little bit make right ventricle and left ventricle. And now we know that from right ventricle, pulmonary artery should rise, and from left ventricle, aorta should rise, right? Both of them. At the beginning, before this symptom is made, aorta and pulmonary looks like this. It means that both of them are together. Pulmonary and aorta are all together. Why? Because the left and right ventricle is not separated. They are not divided. They are together, so their arteries are also together. They are not separated. And a symptom should separate them as well. So before pulmonary and aorta is made, we have like this, or either you can see this. This is called truncus arteriosus. Arteriosus means a big artery, right? Arteriosus means a big artery. Truncus means that a big artery, which is like a trunk, it is a big artery, okay? So whenever a symptom is made in between, this is also coming from the endocardial cushion. And this symptom should separate these two arteries. Truncus arteriosus, that means it is a big artery, like a river. All two arteries goes together. So, and there should be a symptom in between. A symptom should develop in between the truncus arteriosus to make pulmonary and to make aorta. And the characteristic of this symptom is that this symptom has how many characteristics? Let me explain it. This symptom should start from the middle, right? And this symptom should twist and should be a spiral. These are the characteristics of this symptom. So it means that this symptom should twist around each other, and it should start from the middle. Now let's see how many diseases can you make out of the defects of this symptom. We said that This is right atrium, and this is left atrium, and this is the truncus arteriosus. If the symptom is not in the middle, the symptom is made here. This is aorta, and this is pulmonary. What do you call it? If it is not made in the middle. This is called overriding of aorta. It means that aorta is taking too much space. It should be in the middle, right? It should be made, the symptom should start from here. If it is not made in the middle, it starts a little bit to the other side. This is called overriding of aorta. This is a part of tetralogy of Falot, which I'm going to explain later. So if this symptom doesn't twist, just look at this. You see the symptom is twisting. And if this symptom doesn't twist and just comes right away to the ventricles, right? So this is right ventricle and this is left ventricle. You see that from right ventricle, aorta, all the blood from right ventricle go to the system, and the blood from left ventricle will go to the pulmonary system. So this is called that whenever the symptom doesn't twist around each other, there will be transposition of great arteries. One artery will be onto the other side, and the other artery will be to the wrong side. This is called transposition of the arteries. I'm going to explain each of them the next day, because this is just an explanation before starting the next day, because it took us a lot of time to explain the atrial septal defect. And if this symptom is not made at all, you see that one problem was that if the symptom is not made in the middle, what is causing this problem? It's causing overriding of aorta. If the symptom doesn't twist around each other, that there will be transposition of arteries. Aorta will be in the right side and pulmonary will be in the left side. And if this symptom is not made at all, this was truncus arteriosus, right? And whenever the symptom is not made and it stays like this is called persistent truncus arteriosus. It means that the truncus arteriosus persists forever because the symptom is not developed at all. So this was an introduction for the new lecture. I'm going to explain all the details next time, because that is the time for the kids to wake up. I don't want a lot of background noise. That's why I'm going to stop the lecture here. And I hope you liked today's lecture. I'm sorry if I was not able to communicate properly due to
Mahjuba, can
time of.
you yeah, before you
Yes.
wrap up, can you just repeat with the ventricle portion? Um,
Yeah, sure.
I mean, I'm done with the atrium. I understood septum primum, septum secundum, but if you can just it's gonna be a quick one. I
Okay,
just
okay.
don't
No,
want you to
no, no,
go in
not
detail.
a problem.
Thank you.
No, no. Yeah, no, not a problem. Of course. Yeah, however, I'm going to explain it the next day, so in details, but again, we know that this is the ventricles. Ventricles also, atriums were made already, and the ventricles has two parts. One is their arteries. They should also be separated. The arteries are called truncus arteriosus, and the ventricle itself. So we need a symptom not only to divide the ventricles, but also to divide their arteries, because their arteries are, when there is no symptom in between the artery of the ventricles, that is called truncus arteriosus. It means that the outflow for right ventricle and the outflow for left ventricle are the same. Right ventricle and left ventricle will push the blood in the same trunk. They don't have separated arteries. If you see, this is right ventricle and this is left ventricle, right? And
Yes.
this is the muscular part of the ventricles. A little bit divides the ventricle, but not properly. Still, we have if you see, this is atrium, right?
Yeah.
This part is atrium. If we see, here is a hole between two ventricles. There
Yeah.
is a muscular part which is made first. The muscular part of the ventricles kind of divides it into two ventricles, but still there is a hole, right?
Mm-hmm.
So a symptom should, and here is the endocardial cushion. A symptom should start from this muscular part of the ventricles and go towards the endocardial cushion. This symptom not only helps the ventricles to be disconnected, it also helps to separate their arteries, right? If you see, if the symptom goes right, straightforward. Uh, right ventricle will send the circulation to the right side, and left ventricle will send the circulation to the left side. This is not a good idea, right? Because right and left should not have separate circulations, which I'm going to explain next because that's a big topic. So now that we see if this symptom is never developed, if this symptom, which starts from muscular part of the ventricles, will not go to endocardial quotient, if this doesn't develop, we delete it, right? This is the muscular layer, right? This is made, but this part is not made. This is called VSD, ventricular septal defect. It means that the left ventricle and right ventricle will have a connection with each other. This is called VSD, or ventricular septal defect, right? Which is very common. This is also common in Down syndrome and a lot of other syndromes, VSD, and also in tetralogy of Falot, which I'm going to explain next day. So this is called VSD. This is very easy for ventricles. It doesn't have a lot of twists and a lot of explanations. Just we say that ventricles has a membrane in between. This membrane is made of two parts. One is muscular part, which is already made from the beginning. And from this muscular part, the septum or membrane goes toward endocardial quotient and closes the hole or the space between two ventricles and makes right ventricle and left ventricle. And this symptom also helps with the outflow of two ventricles, because once the left ventricle is separated from the right ventricle, their outflow should also be separated. The outflow should also have a membrane. If this membrane is not made, this is called persistent trancus arteriosus. It means that there is no membrane to separate aorta from pulmonary, because aorta and pulmonary at the beginning, it is like a trunk. It is like a trancus arteriosus, right? They should be separated with a symptom. And if this symptom is not made, it is called trancus arteriosus. If this symptom is made, but it is not twisting, twisting helps with the arteries, for example, for, for positioning the arteries. For example, aorta should generate from the left side of the from the left ventricle and goes to the right, like this. Like this, it travels like this, and pulmonary starts from right ventricle and it travels like this. Sorry, like this. It goes to the left and goes to the lung, right? Pulmonary. So because if the symptom doesn't twist and doesn't spiral, these arteries will not have this type of you know appearance, and then a right or a straight away symptom will cause the right ventricle to send all the blood to the right side, and left ventricle to send the blood to the left side, right? It is called transposition of great arteries. And if this symptom is not made in the middle, it is made here. It starts from here, you see. Aorta will be bigger than pulmonary. So this is called overriding of aorta. And at the same time, there will be a hole here. This hole will be called VSD. VSD and overriding of aorta. Now we know that VSD and overriding of aorta is two signs of tetralogy of Falot. And whenever we see that aorta is taking a lot of space, this is pulmonary circulation. Pulmonary circulation becomes so narrow. This is called pulmonary stenosis. This is another sign of tetralogy of Falot. You see pulmonary stenosis. Whenever there is pulmonary stenosis, the right side of the ventricle tries hard to push the blood away from the right side of the ventricle. That's why right side of the ventricle has to work hard, and whenever you work hard, the muscle of the right ventricle will hypertrophy, and the fourth element of the tetralogy of Falot is right ventricle hypertrophy, and we know the reason for all of them. If this symptom is not made in the middle, it is made in the one side. This is called overriding of aorta. Overriding. It means that aorta is taking too much space. This is aorta, right? This is aorta, and this is pulmonary. And one side overriding of aorta, because the symptom is not in the middle from endocardial pushing, it is from the one side. And the other thing is that it takes the space of pulmonary. That's why pulmonary has little space and it becomes narrow. This is called pulmonary stenosis, right? And whenever pulmonary is stenotic, right ventricle needs to work hard to push the blood from a stenotic valve, because if pulmonary is so stenotic, it will not let the blood to come out. So the right ventricle has to push hard. That's why it will cause right ventricular hypertrophy, right? And this one was overriding pulmonary stenosis, right ventricular hypertrophy. We know the reason for each of them. This is the tetralogy of Falot. And the fourth one, because this symptom is made from one side, a little bit hole is made here, because the symptoms should go like this, right? If it is made from this way, there will be a little bit way between ventricles, which is called VSD. So now we know the four elements of the tetralogy of Falot with their mechanisms. We don't need to memorize it. We need to understand the concept. When we say overriding of aorta,
I
why
did
pulmonary
not get
stenosis?
overriding of aorta. I understood all three: pulmonary,
Okay.
VSD, right ventricular, but overriding of aorta, I still didn't
Okay.
get it. Is it
Okay.
just the anatomical or is there a
See,
embryological
this is
significance?
endocardial cushion, right?
Mm-hmm.
Just imagine this is endocardial cushion. This
Mm-hmm.
symptom should start from here and
Mm-hmm.
go from here and twist, right?
Mm-hmm.
Like twist. And make pulmonary aorta, and at the same time disconnect the left ventricle and right ventricle. You understood that up to this part. If
Okay.
this symptom, if this symptom This is endocardial cushion. If this
Mm-hmm.
symptom doesn't start from here, it starts from here.
Oh, okay.
You see, if it
From
doesn't
right
start from the
ventricle.
middle, this is aorta and this is pulmonary. Aorta is overriding. It means that aorta is taking too much space.
Okay.
This is not justice, right? It is not justice. Pulmonary and aorta should start from the middle, and both of them should have enough spaces, right?
Okay.
Whenever the
Mm-hmm.
symptom starts from here, the pulmonary will have less space and aorta will have more space. This
More
will
space.
be called overriding of aorta and pulmonary stenosis. And it makes sense.
Doctor,
Why
Okay, no
uh,
overriding?
worries.
Doctor,
Yes,
overriding of aorta means that the aorta has been changed from the left to the right.
yes, yeah, yeah. This is
Yes, it
how
has been replaced. It has converted to the right instead to go to the left.
yeah.
It goes to the right,
See,
and the
aorta
pulmonary
doesn't,
trunk. The same thing happened to the pulmonary trunk. Instead of go to the
that
left,
is
go to the right.
That is transposition. That's transposition of great arteries. That aorta goes to the right and pulmonary goes to the left. I'm going to explain next day.
Transposition.
Yeah, that is
Yes.
transposition. That is not overriding. Whenever we say overriding, it means that aorta is overriding. It means that aorta is taking more than it should take, right? Aorta is
Again, if you please, overriding what it means. Again, what you
yeah,
said.
yeah,
Uh,
just doctor, listen. Here is endocardial cushion, right? The symptom
yes.
should start from muscular layer. Do you agree with that?
Yes.
It
Yes.
should disconnect the ventricles, and this symptom should spiral and go to the upper part. And this symptom should start from the middle of endocardial cushion and divide this truncus arteriosus into two arteries. One artery should be aorta, and the other should be pulmonary, right?
Pulmonary.
Yeah.
Yes.
And if this symptom doesn't go from the middle, just imagine like this. This is the endocardial cushion, and the symptom, instead of starting from the middle, it starts from the right side. You see, still it
Septum.
is aorta and this is pulmonary. You see that
Yes.
aorta is taking too much space. This is called overriding of aorta. It means that aorta
Ah,
is riding on the pulmonary. Aorta is taking the place of pulmonary, riding over the pulmonary, right? It means
overriding
that,
of
yeah,
pulmonary.
overriding, yeah,
Yes.
riding over the pulmonary. So it takes the space of pulmonary. You see that this is small space for the pulmonary and a lot of space for aorta. It means that aorta is overriding. Overriding to what? It takes the space of pulmonary, riding on the pulmonary, right? So this was one
Yes.
symptom of pathology of Falot, riding, overriding of aorta. Aorta is riding on the pulmonary. Why? Because the symptom started from one side, right? And the second thing, Now that you see that a small space is left here, a small space is left for the pulmonary. This is called pulmonary stenosis. Does that make sense or not? Pulmonary
Yes.
stenosis. So overriding aorta, pulmonary stenosis. We already know the reason. We don't need to memorize it. The symptom
Doctor,
is
why
made.
pulmonary stenosis? Because of
Yeah.
why happen pulmonary stenosis? Because of Falot? Because of what? Pulmonary
So see
stenosis.
here, just let me explain it again. This is endocardial cushion, and the symptom between aorta and pulmonary should start from middle. If it is starting from right side, the space for aorta is increased. Aorta takes more space. This is called overriding. Do you see little space for pulmonary or not? Is it
Space
little or more? This is
where
little
in
space for
the
pulmonary.
no little for pulmonary trunk, little space. Yes.
So isn't it called stenosis or not? When there is
Yes, yes,
little
because
space, this is
short,
called stenosis.
short.
Yeah,
It is,
exactly.
yeah, not, it is a short. Yes.
Yeah. So aorta takes lots of space and pulmonary has little space. This a lot of
Yes.
space called overriding, and this little space is called stenosis. Stenosis means narrow, right?
Narrow,
Overriding means wide. Overriding
wide,
means wide.
wide.
We don't need to say wide and narrow because in the question they will ask us pulmonary stenosis and overriding. That's why we should get used to the words that are appearing in the exam. Overriding means that aorta is big or aorta is white. Why it is white? It shouldn't be white. It is taking the place of pulmonary. It is not justice, right? It is not good that aorta should have its own space and pulmonary should have its own space. But here aorta is taking the right of pulmonary, the space of pulmonary. That's why it is called overriding aorta is wide. And pulmonary has little space. Why little space or narrow space? Because the aorta took its part, right? So it is called pulmonary stenosis. Now that you see the symptom is not made from the middle, the symptom is made from here, right? Symptom is made from here. Do you see a disconnection between ventricles or not?
Yes,
Because the
doctor, I
symptom,
am seeing
yeah, this
this.
is VSD, right? And
Yes.
that's the fourth one. Whenever you see that
VSD is the
pulmonary,
connection between the right and left ventricle.
yes,
There,
exactly. And
there is some connection between the right and left ventricle.
yeah, this is called disconnection, yeah, because the symptom is
Yes.
not from the middle. The symptom should be from the middle, right? If the
The
symptom comes from
septum.
here, there will be a disconnection between two ventricles. There will be connection between two
It
ventricles.
means that the septum goes a little bit away from the middle.
Exactly, yeah. The symptoms
Yes.
goes from
Okay.
here, right away. So there will be connection between left and right
Okay.
ventricle. So now that you see that pulmonary is stenotic, this is right side of the heart, right ventricle. Right ventricle has to work hard. Why does it have to work hard? Because pulmonary is stenotic. Right ventricle needs to work hard to push the blood out. Do you agree with that?
Yes, yes, doctor.
So
The right
this
ventricle
will
will
cause
be
right ventricle
doing more
hypertrophy.
hard work
Yeah, why more work? Because the stenotic valve, when
because
the
of the
way is
stenotic
closed,
enzyme.
it needs to push. It needs to push, right? So the
Yes.
work of ventricle will be increased and it will cause right ventricular hypertrophy. Believe me, if you study tetralogy of Falot this way and you understand the mechanism of the embryology, you will never need to memorize anything. You don't have to use pictures, cartoons, or whatever to understand tetralogy of Falot. It's easy. The mechanism is easy to understand because the symptom is made in the other side. Pulmonary is small, aorta is big. It is called overriding. It is called pulmonary stenosis. Once the pulmonary is stenotic, the ventricles needs to work hard and to push the blood out, and this is called right ventricular hypertrophy. However, I didn't have the plan to teach the tetralogy of Falot today because it is in pathology, but still, it is not bad to study, to connect pathology when we are studying embryology, right? And about the
Yes.
transposition of beta 3 about the persistent transarteriosis and other stuff we are going to study next day, only if you want to continue. And the lecture for today, I guess, is enough, right? Let
All right,
me
doctor.
start